Welcome to Nursing Related Philippine Jurisprudence, written and narrated by John Igor T. Galinato. This next case is captioned Dr. Casumpang et al. Versus Nelson Cortejo, GR number 171127, March 11, 2015. The facts of this case are as follows. Mrs. Cortejo brought her 11-year-old son, Edmund Cortejo, to the emergency room of San Juan de Dios Hospital because the child had difficulty of breathing, chest pain, stomach pain, and fever. The child was assigned to Dr. Casumpang, a pediatrician, who, using a stethoscope alone, diagnosed the child with bronchopneumonia, even though the child had high fever and no cough or colds. The next day, the mother reported to the doctor that the child had fever, throat irritation, chest and stomach pain, and traces of blood in the sputum. Still, the doctor stuck to his diagnosis of bronchopneumonia, running no further diagnostic tests. When the resident doctor, Dr. Ruby Sanga Miranda, arrived, the child already had severe stomach pain and difficulty moving the right leg. The child was diagnosed with dengue hemorrhagic fever by Dr. Ruby Sanga Miranda and transferred to Makati Medical Hospital, where the child was diagnosed with dengue fever stage 4, which is already irreversible. The child died at 4 a.m. of April 24, 1988. The parents filed civil suit against both Dr. Casumpang and Dr. Sanga Miranda. The regional trial court found both doctors and the hospital solidarily liable because Dr. Casumpang, as a consultant, is an ostensible agent of San Juan de Dios Hospital, while Dr. Sanga Miranda, as a resident physician, is an employee of the said hospital. Upon appeal, the Court of Appeals affirmed in toto the RTC, ruling that the doctor's failure to read even the most basic signs of dengue fever expected of an ordinary doctor constituted medical negligence. The Court of Appeals also gave merit to the testimony of the expert witness, Dr. Rodolfo Haudian, that the hospital San Juan de Dios is also negligent because it was not equipped with proper paging system. It has no bronchoscope, and its doctors are not proportionate to the number of its patients. And of the 7 resident physicians, only 2 resident physicians were doing rounds at the time of the child's confinement. The issue in this case is whether or not the doctors and the hospital are solidarily liable for medical negligence. The Supreme Court ruled yes. Dr. Casumpang and Hospital San Juan de Dios are both solidarily liable. The Supreme Court ruled that the elements of medical malpractice were duly proven in this case, namely duty, breach of duty, injury, and proximate causation. On the other hand, Dr. Sanga Miranda, the resident physician, was acquitted because she was actually the one who correctly diagnosed the child with dengue, gave due care, and referred the child to Makati Med. But Dr. Casumpang, the consultant pediatrician, was held liable because it was opined by the expert witness, Dr. Haudian, although not a pediatrician but a practicing physician who specializes in pathology, that Dr. Casumpang's medical examination was not comprehensive enough to reasonably lead to a correct diagnosis. Dr. Casumpang only used a stethoscope in coming up with the diagnosis that Idmer was suffering from bronchopneumonia. He never confirmed this finding with the use of a bronchoscope. Furthermore, Dr. Casumpang based his diagnosis largely on the chest X-ray result that is generally inconclusive. A wrong diagnosis is not by itself medical malpractice. The question in professional malpractice suits is not whether a physician had made a mistake, but whether he or she used ordinary care. When a physician's erroneous diagnosis was a result of erroneous conduct, example, neglect of medical history, failure to order the appropriate test, failure to recognize symptoms, then it becomes an evidence of medical malpractice. At the present case, the evidence on record established that in confirming the diagnosis of bronchopneumonia, Dr. Casumpang selectively appreciated some and not all of the symptoms presented, and failed to promptly conduct the appropriate test to confirm his findings. In sum, Dr. Casumpang was negligent when he failed to exercise reasonable prudence in timely detecting dengue fever. Furthermore, medical literature in dengue shows that early diagnosis and management of dengue is critical in reducing the risk of complications and avoiding further spread of the virus. The Supreme Court, citing the WHO, that Edmer later died of hypovolemic shock, hemorrhagic fever stage 4, a severe and fatal form of dengue fever, established the causal link between Dr. Casumpang's negligence and the injury. The Hospital San Juan de Dios is solidarily liable because of based on the principle of agency or the doctrine of apparent authority. A hospital can be held vicariously liable for the negligent acts of a physician or an independent contractor providing care at the hospital if the plaintiff can prove these two factors. Number 1, the hospital's manifestations that the doctor is its employee, like placing his name in the lobby of the hospital, or failing to advise the patient that they are being treated by the hospital's agent and not its employee. And number 2, the patient's reliance thereon. For example, a patient entering the hospital through the emergency room could properly assume that the treating doctors and staff of the hospital were acting on its behalf. In this case, the court considered the act of the hospital of holding itself out as a provider of complete medical care, and considering that the hospital to have impliedly created the appearance of authority. Thus, San Juan de Dios clothed Dr. Casumpang with apparent authority. The Supreme Court found Dr. Casumpang as San Juan de Dios solidarly liable for negligent medical practice. Civil award consists of moral damages of 500,000 pesos, burial and funeral expenses of 45,000 pesos, for a total of 545,000 pesos. The liability of Dr. Sanga Miranda was set aside.